We've all heard the saying, use it or lose it. And when it comes to sex, it can sound a little scary, but the truth is more complicated and honestly more fascinating. For men, it's true that guys who stay sexually active often have better erections with age. But that's not because sex magically preserves them. It's because those men are already healthier to begin with. The male body actually has its own built-in safety system. Every night while you sleep, you get 3 to 5 erections, and these aren't random. They're your body's way of pumping fresh oxygen, rich blood into the penis to keep the tissue stretchy, elastic, and functional. As long as you're having those nighttime erections, you're not losing it. Even if you're not having sex, the problem is when health conditions, like high blood pressure, diabetes, or high cholesterol, cut off that circulation. That's when you lose those nighttime erections, and over time the tissue starts to stiffen, scar, and even shrink, which is exactly what people mean by losing it. That's also why ignoring erection issues is risky. Early treatment can prevent long-term damage. On top of that, regular ejaculation has been linked to better prostate health, possibly lowering cancer risk, and sex itself can help maintain testosterone, which fuels desire and performance. Every orgasm also gives your pelvic floor muscles a workout, and those muscles are the secret engine behind strong erections and bladder control. The takeaway: forget penis exercises. What really matters is overall health, good diet, regular exercise, solid sleep, and stress control. Men who keep themselves healthy can, and do, have great sex well into their 80s and 90s. For women, the story is just as interesting. Women who stay sexually active often report better lubrication, elasticity, and pleasure, but again, that usually reflects that they started off healthier or had fewer issues. After menopause, things like dryness or discomfort are common, but they're highly treatable with safe options like vaginal estrogen, lubricants, or moisturizers. And just like men, women also get a natural boost from their bodies. At night, the clitoris fills with blood 3 to 5 times, keeping the tissues healthy even without sex. When circulation suffers, though, arousal and orgasms can weaken, which is where tools like vibrators are fantastic, not only for pleasure, but also for keeping blood flow strong. Orgasms also fire up the pelvic floor muscles, which is especially important after childbirth, when weak muscles can lead to leakage or urgency. In fact, studies show that orgasms are just as effective as Kegel exercises at strengthening the pelvic floor, so sexual activity doubles as a natural workout. Put it all together, and here's the bottom line: use it or lose it is partly true. If your body is still giving you those nighttime erections or clitoral engorgements, you're not losing anything just because you're not having sex. But if health issues take those away, then yes, without stimulation and blood flow, the tissues can weaken and shrink over time. That doesn't mean you should pressure yourself into sex. It means you should focus on protecting your health, because circulation is everything. And when you do choose to have sex, it comes with incredible bonuses: better mood, stronger relationships, brain health, longevity, and that unbeatable sense of connection with another human being. So the real secret isn't about using it. Every day it's about living in a way that keeps your body strong, your blood flowing, and your pleasure alive. Sex is great for you if you enjoy it, but even more important is taking care of yourself, because you are absolutely worth it.